Thank you for joining us tonight. The U.S. is approaching a major milestone in the fight against coronavirus. The White House says by the end of the weekend, nearly half of all adults will have had their first shot. As of today, more than 171 million doses of the 3 FDA-authorized vaccines have been administered. The COVID-19 vaccine offers protection, but in some cases, some unpleasant side effects.
And that just means your body is working, but you may experience different symptoms than you would with a flu shot. Madeline O'Neill is live at the Alliant Energy Center tonight to tell us what's normal. Maddie?
Well, most of us know someone who's gotten side effects. Personally, after my shot, I got the fever, headache, body aches, something I never experienced with, say, a flu shot. Now, that can happen with any of the 3 COVID-19 vaccines you get. So we wanted to find out why we're seeing these symptoms and what you can do to help get yourself through them.
I was excited.
A common emotion going into getting your vaccine, along with some hope.
Both of my grandparents are finally vaccinated, so in 2 weeks, I can see them again.
Also common, the less fun side effects, which really kicked in for Alex Van Rossum about 12 hours after her Johnson & Johnson shot.
I started to get really, really achy, got a headache, and then I started getting chills and developed a fever.
These are very reactogenic vaccines. Their job is to produce those effects so that your body can remember when it sees this virus to go after it.
UW Health's Dr. William Hartman explains that your body building defense causes inflammation, leading to those symptoms. Side effects may be stronger in people who already had COVID-19 after someone's second shot, or in younger people with more robust immune systems. But what if you don't get side effects?
That doesn't mean that your body's not doing what it's supposed to do. It just means that you have kind of the golden ticket.
SSM Health registered nurse Jennifer Bothan says she is noticing more side effects from the COVID-19 vaccines than a typical flu shot.
I don't know if it's necessarily worse or if we're just paying more attention to it.
She says the most common side effect is arm soreness, and only about 10 to 15% of SSM Health employees had symptoms severe enough that would lead someone to call into work. Even then,
a couple of days of not feeling well is a small little price to pay for some immunity over, a potentially devastating disease.
That's the side effect that makes all the others worth it.
I'll deal with some weird side effects now to ensure that, a global pandemic can get under control.
If you do end up getting a fever, doctors say it's fine to take some ibuprofen or Tylenol after the shot. You also want to stay hydrated. Now, if those symptoms do continue past about 48 hours, health officials say that might be the time to seek medical attention because it could be from something else. Usually these side effects are pretty short-lived.